Bismillahirrahmanirrahim. Today we will have case quiz number 33. Case data: 64-year-old male referred urgently by his general practitioner with acute neuropathy. 2 days prior to presentation, the patient awoke to find himself unable to lift his right foot and toes while walking, such that he kept tripping. Over the next 24 hours, he found he had lost control of his left thumb and couldn't grip things properly. So, right foot and left thumb. His problems were associated with altered sensation in his hand and foot. His past medical history is entirely unremarkable. By examination, he had high steppage gait and inability to dorsiflex the right foot and walk on his heels only. Sensation is diminished over the top of the foot and ankle of the right side, of course. In the left hand, there is loss of abduction and opposition of the thumb and reduced sensation in the lateral 3.5 digits. So it is an acute neuropathic condition. So what is the diagnosis? The answer is yes, mononeuritis multiplex. Mononeuritis multiplex. What is mononeuritis multiplex? The patient has complete loss of median and common peroneal nerve function. The abruptness of onset and anatomically distinct nature of the loss suggests an intrinsic nerve problem rather than a compressive neuropathy. The diagnosis is therefore mononeuritis multiplex, the loss of motor and sensory function of individual peripheral nerves, multiple individual peripheral nerves. Mononeuritis multiplex arises due to interruption of the vasa nervosum, the blood supply to peripheral nerves, and one of the most common causes of this is vasculitis. Another major cause is diabetes mellitus, but not relevant in this particular case. Vasculitis, which is inflammation of blood vessels and subsequent obstruction to blood flow, can be primarily idiopathic or secondary, in which case it is associated with an underlying condition such as rheumatoid arthritis or systemic lupus, of course. Primary vasculitis is divided clinically according to the vessel's involvement. As we all know, vasculitis can be divided into large vessel, medium vessel, or small vessel vasculitis according to the most commonly involved vessel or vessel types. Regarding mononeuritis multiplex, it can be caused by any of the medium or small vessel vasculitis, and the patient should be approached with this differential in mind. Specific clinical features from each of the differential diagnoses should be sought in the history and examination, bearing in mind that there will be a considerable overlap. Skin involvement, for example, is very common in all types of vasculitis. The more discriminating features would include lividity reticularis, back pain, testicular pain in polyarthritis nodosa, sinus or audiovestibular disease in vaginal granulomatosis, adult onset asthma or nasal polyps in Churg-Strauss disease, abdominal pain and rectal bleeding in Henoch-Schlein-Barber. Investigations in patients with suspected vasculitis should be chosen to confirm the diagnosis and define the extent and severity of organ involvement. A crucial investigation in cases of mononeuritis multiplex is nerve biopsy, and a common site for this procedure ischial nerve. Management of mononeuritis multiplex is based on potent immunosuppression, often in the form of high-dose corticosteroid and cyclophosphamide, and the treatment of underlying infections such as hepatitis. The patient with food drop will also require orthopedic and physiotherapy to maximize physical function. And finally, thank you very much for your attendance, and see you tomorrow with the next case quiz number 34. Wassalamu alaikum wa rahmatullahi wa barakatuh.